As of March 31st, about $9.8 million was collected in revenue from travel health visa. And as of late, questions are being raised about where that money has gone. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. As borders reopened in November and air service resumed, a requirement for entry has been the approved Bahamas travel health visa. The $40 fee, accompanied by a negative PCR COVID test, allowed thousands into the country. As restrictions even visa costs drop, the debate over these travel visas has escalated. Questions are being raised about the validity and the need for travel visas, especially for inter-island travel. Besides the pricing of the travel health visas, questions are also being raised about the $7 million price tag and why has a third party, Canoe Pays, been responsible for collecting that money. Tonight on The Record, we discuss the travel health visa with the Minister of Tourism. Stay tuned. Our discussion begins on the other side of this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we are discussing the health travel visa. To dispel the many false claims of the travel visa, on June 23rd, a press release was sent out by the Ministry of Tourism that said in part the reasons why Canoe Pays were selected and the reason for the travel health visa. Yet questions loom. Well, my guest tonight will hopefully answer some of those questions and even more. I'd like to welcome back to On the Record the Minister responsible for tourism, the Honorable Dionisio D'Aguilar. Minister, welcome to the studio. Good to have you.
Jerome, it's so delightful to be back here in person.
I have to tell you, sir, you have the distinction of being our very first studio guest in almost a year.
Oh,
and
I'm honored.
All you do is present your vaccination card.
Get vaccinated, that's good.
That's the first message, So we're happy to have you in here. Lots of questions, sir, but certainly let's sort of first of all lay the groundwork as to why was there a need to attach a cost to the travel visa. I think when it was first announced, people thought, well, why are you charging for this? We're already having to pay for the negative PCR. Why was the cost implemented for the travel visa?
So when the travel visa was implemented back in July, it was very rudimentary. And as we loomed towards the reopening of tourism, as you know, we had a false start in July. Mm-hmm. So as we loomed towards the reopening of tourism on the 1st of November, we decided to develop a robust health visa. And the reason why we needed the health visa was that the requirements to enter the country were twofold. The first was to get a PCR test within 5 days of arrival. But once you arrived in the country, you had to get a rapid antigen test 5 days after your arrival. That's if you're a returning citizen or resident. If you were a visitor, you were entitled to health insurance. So let's deal with the visitors first. So the visitors coming into the country, we wanted them to have mandatory health insurance. So if they got sick, there was a mechanism by which they could get out of the country. Of course, we have a very limited number of beds in our country. So we didn't want anybody staying here and burdening our health system
So the idea
anymore.
was to get them out. If
Yes,
they got
so there was a cost to cover the health insurance. The government was adamant that everybody coming into this country would have health insurance. And so we had to go out and source that. There was a cost associated with that. And so as the visitors came in, the cost associated with their visa was the health insurance. And if they were here beyond the 5 days, we added on the cost of the rapid antigen test. Of course, for returning citizens and residents, most of them have health insurance here, or if not, they can go to the public hospitals. So there was no need for them to have the health insurance, but there was a cost associated with having the rapid antigen test on day 5. So you apply for the visa. You get your PCR test overseas, you upload that. Now, the reason why we set up this visa was because when we launched our program, the airlines told us point blank, we're not checking any of these PCR tests. Now, that was back in July, August. They said, we're not doing it. So we understand visas. So what we suggest you do is you set up a visa system and you upload this PCR test. You check it, you validate it, you verify it, and you issue a visa so that when they show up at the check-in counter, we know that it's the right test, with the right result, within the right time period, from an accredited lab. To expect a check-in person to check all of that just wasn't going to happen. And it was amazing that when we weren't as robust in our checking, people were showing up at the border with blood tests, they were showing up with rapid antigen tests, they weren't showing up with the PCR test. And that was causing mayhem at the border. That was a very unpleasant experience. Can you imagine now? You get on the plane, you fly down here, you've presented your test to some check-in person, they blessed it, they got down here, you check it, it's the wrong test. So the government was, you have to go back. And that was ripping families apart, people screaming and crying at the airport. We said, no, this ain't gonna work. This is not a pleasant experience. Let's let everybody upload so that before they even get on the plane, we vetted the correct test. And so the cost, to get back to your original question, the cost for returning citizens and residents was to cover the cost of the rapid antigen test on day 5, and for the visitors was to cover the cost of the mandatory health insurance that they were required to have. Now, even if you look at the test of a rapid antigen test, we had to build a network throughout the country where you could go and get this test on day 5. Imagine you arrive in Nassau, you then on the 3rd day of here, you go down to Acklands. So where am I going to do my 5-day rapid antigen test? So we had to build a whole network of clinics. We had to design a system that when you got your visa, on that visa was what we call a QR code, like a barcode. So then when you were down in Acklands, we had to send iPads down there. So when the healthcare provider did the test for you, they would scan that QR code, they would put in that it was positive or negative, and it would upload to our system, and we could see whether you would A, receive the test, and B, what the result was. So all of that network had to be built out in order for us to fulfill the requirements as mandated by the health officials. So there was a lot of cost of getting this to get it up and running.
So there were a lot of startup costs.
Absolutely, and to maintain it. I mean, you think about it now. You've got to there's only one certain type of rapid antigen test that was blessed by the Ministry of Health. You couldn't get it from, off the shelf or wherever. They had to clear the type of tests that we were using. We had to get them in. We had to distribute them out to all of these 117 clinics we have throughout the length and breadth of this country. And then we had to get the results back up to NASA. You had to manage all of that inventory. You had to pay everybody. It was quite...
You were able to say what the price tag was?
I haven't looked at, I haven't figured that out yet.
You think several million? Or?
Oh, yeah, absolutely. Yes, absolutely. I mean, you have to cover the cost of the insurance. You have to cover the cost of the test. You have to pay the healthcare provider to administer the test. You have to build the IT backbone. All of that needs to...
One of the issues that people raised was the insurance. Why is it that our visitors are covered by this insurance? We're all paying the $40 and Bahamians are not. I think you would have mentioned what the thinking was, but let's go into that a little bit more. Why not provide some level of insurance for Bahamians?
So the visitor, the insurance was just to get them out of here. That was our intention. You come here, you become symptomatic, you test positive. Our objective is we do not want you to remain in this country because we have roughly 100 beds. So we don't need visitors coming in here and using up our useful beds for our citizens. So the objective of the health insurance was strictly to test them with a rapid antigen test, confirm it with a PCR test, put them on a plane, send them to Florida.
A special plane, eh?
Yes, oh yeah, you couldn't put them on a commercial plane.
Flight, right.
So you had to charter a plane, a medical evac, and charter a plane and send them to the United States and drop them in Florida and then let them go from there. Because we did not want these foreign visitors to burden our healthcare system. We have a limited amount of beds, we have a limited amount of healthcare facilities, and we wanted to ensure that they were exclusively used for Bahamians.
Great. So we've set now the groundwork. Fast forward to several weeks ago, it's reported that the government has received some 9.8 million from the travel health visas. 7 million went towards expenses. So let's talk about the 9 million collected and what the 9.8 collected and what the 10 and what the 7 million was used for.
So you've got to pay for the health insurance. So that's a large portion of it. A portion of it goes to value-added tax because that's included in the price. You have to pay for the medical professionals who are administering the 5-day rapid antigen test. You have to pay for the rapid antigen test, and you have to pay for the technology to keep it. I mean, as you can imagine, the emergency orders were constantly changing, so we had to constantly be employing the programmers to make changes to the program. This island is now requiring a test. This requirement to come in has changed, so we had to constantly be updating.
So Grand Bahama and others had different requirements as the numbers went up, eh?
Yes, and then obviously, for example, now we've reached the stage of vaccinated. So vaccinated people don't need a rapid antigen, don't need a PCR test to enter the country anymore. And effective the 1st of July.
Today?
Yes, effective today. All citizens or residents coming into the country who are fully vaccinated, there's no cost associated with it. You just got to apply for it, show that you're vaccinated, and it's free.
And you've dropped the cost on inter-island travel for those who are vaccinated.
Yes, anyway, as soon as you get the second shot, you're considered vaccinated for inter-island travel. Certainly when you're coming across the border, you have to ensure that you've been vaccinated for the full 14 days, but it's still free. So, it's a very fluid situation. It's constantly changing. And, we have to make tweaks to it as events evolve on the ground.
So let's talk about Canoe Pays, because this was the company that was used or is being used to collect the funds. How and why were they selected to do this?
So, we were developing the website. We were, of course, in constant communication with the website developer. We employed them at the end of September. So really, we have 5-6 weeks to get this web page or this website up and operationalized. As we drew nearer to the 1st of November, 5 or 6 days before, the government decided, okay, we're going to mandate the insurance and we're going to mandate the test, and we want the persons who are using the website to pay for those services. So to get a 5-day rapid antigen test and to pay for the insurance. And so, here you are 5 or 6 days out from the launch of this website. Conducting an RFP exercise would have been absolutely impossible. We would not have met our deadline of the 1st of November. The developer said to us that he had worked with Canoe on the food program. He said he believed that they had the technology and they had the wherewithal to bring this on by the 1st of November. And so they were employed. It was just a matter of getting this website up and running. So, hindsight is...
Now that raises some questions for me. So at any point, did anyone in the room raise their hand and go, how are we going to collect this money? So you're telling me this just 5 days out, you go, how are we going to collect this money?
So, the building the website was really the focus for us. I have to say that is where we directed our energy. We were meeting every day for 3 and 4 hours to go through this website and think of all the different scenarios. And really, really at the end of the day, we weren't considering that this was going to cost anything, right? And so when the government decided, okay, now we want the insurance, and that was decided pretty late in the game that we were going to have this insurance, and that we're going to do this rapid antigen test, the cost began to factor in. So we said, okay, now how are we... And I must say, I was a little naive about this. I thought that, it would take 2 seconds to roll this in. I just set up a credit card payment system, and I really wasn't focused on that end of it. So when it came down to the very last minute before we got operationalized, we had to select someone. Honestly, I'd never even heard of Canoe. I didn't know who their shareholders were. There's some, obviously the pundits are saying that they're connected with the FNM. Okay, certainly wasn't knowledgeable to me. And they were selected. Hindsight, okay, I agree. It should have gone out to bid, and maybe we should do that now.
I was going to ask that I get it. You had to get something in place, but why not say, okay, well, let's make this temporary until we can do an RFP and let Canoe and others then now reapply to be a part of it? Because now you're dealing with a situation of optics, Minister.
Yeah. So now, you're right, we're 8 months into this, and we've had a web page that has been very fluid. Once we launched it, there were issues with it. We had to correct it. Our focus really wasn't on the payment feature of it. The focus was on the customer experience. And that's where we focused all of our energy. But you're absolutely right. I think the time has come for us to put it out to competitive bid. Let's look at the numbers here, because everybody seems to think it's an enormous amount of money. So if it's $10 million, 1.5% is $150,000. Right?
So that's what Canoe Pays received.
That's what they've received in revenue. Then they have their expenses. Sure. And then they net from that whatever they net. So, it is an amount of money, but it isn't a huge amount of money. And I was more focused on the fact that we had 425,000 visitors use that website. The fact that those 425,000 visitors spent on average $1,800, that has generated $750 million of impact on our economy. That is where my focus was. That is what I wanted that website to work. I wanted people to use it, and I wanted it to work well. So that's what my focus on. Hindsight, I should have brought some focus to this.
And that's understandable. But I do want to ask you whether this speaks to a larger issue. There seems to be, for all the explanations you and Canoe Pays and others have given, there continues to be a lot of skepticism and questions continuing to be raised. Are you all facing a major trust deficit between the government and the public? It seems as no matter what you put out there are even more questions raised.
Yeah, obviously, in a perfect world, that process would have been followed. Here we are in COVID. We're trying to get our tourism economy back up and operationalized. Are we thinking of everything? No, we're humans, right? So we don't think of everything. We made some mistakes. I'll openly admit that. But, I can categorically state that every single dollar that was earned from the visa went into the Treasury, will end up in the Treasury. All of it was accounted for. I think the Bahamian people can rest assured that, yes, the process could have been more perfectly applied. It wasn't. I concede that. But rest assured that every single dollar that was collected will end up in the Treasury and will be for the benefit of the Bahamian people.
Do you, though, understand and appreciate what some of the anxiety and angst is about?
Absolutely.
The FNM would have campaigned on a platform of transparency and accountability. Throughout the campaign, you accused the then government, the PLP, of doing all these under-the-table deals and all this underhandedness. And now here it is, a company that has ties, their principals have ties and major ties to the FNM, has been handed this contract that's now dealing with millions of dollars. You begin to see now why people are expressing this anxiety and concern and loss of trust.
So they're dealing with millions of dollars, but all of those millions of dollars will end up in the Treasury, and their fees will be $150,000. So
I understand that, Minister, but the argument is, you're coming after the fact. Now that it's, and people are concerned. Like, my grandmother used to always say, it's not a crime till you get caught.
Yeah, I completely agree with that. And had the situation been different, had it not been COVID, of course we hadn't, the health visa was something new. This was something that we were rolling out for the very first time. We were finding our way. We were learning as we went on. This was a very difficult period. And of course, all of your citizenry, all of your constituents in Freetown, looking for tourism to reopen, to get people back to work. And that is where our focus was. Let's get the economy open. Let's get it operationalized. Did we tick every box? Did we follow every procedure? Absolutely not. Is any money gone missing? Absolutely not. Has all the money gone into the Treasury? Absolutely. And so I feel confident that all of the people's money is where it should be. I am confident that the rollout of the health visa has been as good as can be expected. And, tourism is bouncing back and people are coming to the country. And you know what? They have accolades. They have heralded this visa for working very well. They feel safe and it is easy to navigate. And I think it has contributed to the rebound that we're presently experiencing.
We're going into a break, but I do want to tell you this. I've traveled several times since November. And every time I make it my business to talk to tourists and ask them how I feel about coming in. And the majority of them, if not all, have said to me, we feel safe.
Yes. And that
process makes them feel safe. Having to present the test and the visa, it makes them feel safe that they're coming into a safe environment.
And that's absolutely the point. And we maybe on the side of break we talk about.
We have lots more to talk about.
Yeah.
And he directed the show. Don't go anywhere. We have lots more to talk about. You're watching On the Record. We are back right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back. You're watching On the Record. I'm your host, Jerome Sawyer. Tonight, we are discussing the now controversial travel health visa. In the past month, there has been a lot of criticism around the travel health visa payments through the Canoe Pays service. Transparency and accountability is very important to the Bahamian people. Questions based on misinformation and misunderstandings over whom is holding the money. Tonight, we are pleased to have on the Minister responsible for tourism and aviation, the Honourable Dionisio D'Aguilar. Minister, PLP Opposition Leader Brave Davis has mentioned that there has been no oversight of the collection of the travel visa funds. I want us to play a portion of some remarks that he gave recently and then have you to respond.
And these profits are at the expense of the people. The outsourcing of the collection of government revenues and taxes by a third party is unprecedented. To make matters worse, there is no oversight or accountability of the collection of millions of dollars associated with the travel visa fees.
Minister, that was from a press conference held by the opposition leader, which I think really got a lot of this going and raised these questions. I want you to respond to his statements.
So the leader of the opposition is a lawyer, and so I'm an accountant. So I can tell you categorically that the website, when you go onto the website and you purchase your visa, at the end of every single month, there's a reconciliation done between what was paid for on the website and what money was credited to the Ministry of Tourism's account. That reconciliation gets done every single month. It's within 99.9% of being accurate. And so that is completely false. That statement is irresponsible and it's untrue. So every month we know exactly what we should have earned based on what happened on the website and what was credited to the account. A reconciliation is done. And then the money is scooped out of the Canoe account, that is the Ministry of Tourism's account at Canoe, and sent to the Treasury.
And are these things audited? I mean, is someone else overlooking them as well?
So, the audit. So an audit, I used to be an auditor. Mm-hmm. An audit usually takes place after the passage of a certain time period. Okay. So usually it's a year. Once you have financial statements for a year, the auditors come in and validate and verify. It's after the event. But the Ministry of Tourism has an accounting department, as I said, and every month We figure out exactly how many people came, exactly what every person paid. We total it, and then we compare it to the bank account, and there's a full reconciliation done. And it's done by individual. So we have, in the first month, let's take November, we had 14,000 records. And in the month of June of this year, we had 131,000 records. So all of those records are downloaded into an Excel spreadsheet. It's all added up. It's all validated. It's all verified. And then we compare it to the bank account to know that the amount that is the revenue on the website is exactly the amount that was credited to the Ministry of Tourism's account with Canoe.
And these monies go to the consolidated fund?
Yes, they're scooped into the consolidated fund to then deal with the payments of the expenses.
So something else that he mentioned that I wanted to bring up, he said the collection of government revenue by a third party is unprecedented. Is that the case? And secondly, why not have Ministry of Finance or some other department collect these monies as they do with other things?
So, the government, as it moves to cashless, remember now, this travel visa is all online. And so you don't need every single individual charge going into the consolidated fund, every $40 less the fee going into the account, right? So you have these electronic payment providers, these credit card providers, and they're the company, like Canoe, that links the web page to the cash. And so they provide that service. So the government uses this for the collection of immigration fees, uses it for the collection of court fees, road traffic. There are many ways that the government is now using electronic payment providers to collect services that they provide. It temporarily goes into the Ministry of Tourism's account with Canoe. The audit or reconciliation is done, and then it's scooped into the Treasury. So, I always am very amused by that press conference. The one person that wasn't there, the deputy leader of the PLP, Chester Cooper. He is intimately involved with Cash and Go. Would he have not been the person to speak on this matter? But he wasn't there. So why was he not there? Because he understands how it works. He provides that service to the government. And they do a wonderful job, as do all of the other internet payment providers. They know how it works.
Are you satisfied, though, that all of the answers given have adequately addressed the concerns?
I am 100% certain that no government money went missing. And the fees that were paid to Canoe are no more than what they would have been paid to any other provider. The government has set a bar. We pay you 1.5%. And they were not paid more than 1.5%. So I am 100% confident that because of this relationship, while imperfect in how it was allocated, the government yielded exactly the amount that they were supposed to yield, and there is not $1 missing.
Okay, strong statements. Let's talk about sort of the beneficial source of all of this. This created another source of revenue for government at a time when a lot of collections were down. I mean, government wasn't making a lot of money because the economy had really come to a standstill. Given all that was put into it, you say you're an accountant, you're a businessman for sure. When we look at what was spent versus what was netted at the end of the day, did it make good business sense?
So the intention was not to make a profit on this. The intention was to cover the costs. Okay, so we had to fund this new visa, which was mandated by the Ministry of Health to check the health protocols of persons entering the country. We had to set that up, and I'm 100% confident that it served its purpose. Now, if someone didn't take a test, and they paid for a test and they didn't take a test, yes, the government makes a windfall on that, but that was not the intention. The intention was for this website to break even, to just cover its own costs. The government, of course, is very financially challenged, providing assistance to all of the persons that were impacted by COVID-19. So this was, when we set this up, this had to be revenue neutral. Now, if persons don't use the service that they paid for, that's a little bit of a windfall to the government. And it's very important to point out that as time moves on, more and more of these fees are being paid by non-Bahamians. So in the press release, we would have said that 82% of the fees were being paid by non-Bahamians. And as time goes on, that percentage will increase because obviously now persons coming into the country who are vaccinated will pay nothing. Mm-hmm. If you are vaccinated, you pay nothing. So the the tape.
So this is for visitors as well, or visitors will continue to pay?
Yes, because they have to have the health insurance.
Gotcha.
But Bahamians returning home will not pay anymore. So, the burden to the average Bahamian, first of all, it only burdens persons that travel, first and foremost. But that burden is diminishing as more and more Bahamians and residents get vaccinated.
Mm-hmm. The opposition would have also suggested that maybe the airlines could have done a better job at this, which you have responded to.
They drew an analogy to other countries in the Caribbean. They say that's what they do. They have the airlines check it, and when they land, they enter in. What they don't tell is the whole story. So, for example, let's take Barbados. So first of all, you got to get a PCR test 72 hours before your arrival in Barbados. So let's assume the airline checks the test. When you arrive in Barbados, everybody must get a test on arrival. We don't have a test on arrival. So we got to make sure that the test you're submitting is the right test. Then when you get to Barbados, you go to a hotel and you quarantine in that hotel until that test result is received. If you're vaccinated, they expect you to be quarantined in that hotel for 1 to 2 days. If you're unvaccinated, you must remain in that hotel for 5 to 7 days. So there's another part of the story that they're not telling. Yes, those countries may say, look, we'll check it on arrival, but they're going to give you a test on arrival, and they're going to subject you to some sort of quarantine upon your arrival. We don't have any of that. It was impossible for us to do, given the fact that we're an archipelagic country. We just couldn't be testing at all of these different ports of entry. Barbados has 1 port of entry. Jamaica has 2. So it's very easy for them to make a mistake. Let's say the airline person doesn't catch it, and they get into the country. You have to have a test anyway. And that wasn't our intention. We could not set up all of these testing sites at our 15 or 20 ports of entry. It became too cumbersome to do. And so we decided we would set it up as the airlines, actually, the ones advise us, like we do visas well. So when we first started this out, we were the first ones to come out. We want a PCR test and we want it to be checked because we want to reopen tourism. A lot of countries haven't even reopened tourism yet. Cayman, no tourists could go to Cayman. Trinidad, still closed. And we have had to balance the reopening of our economy with the health protocols. And that health visa has served us well. And then on top of that, something that nobody ever talks about is the wonderful data that we are collecting on our foreign visitors. We get where they're coming from, we're getting their emails, we're getting all sorts of wonderful data that we can use to strategically market our destination.
And it does send you, after you've gotten the approval, it sends you to the Ministry of Tourism site. As soon as you get your approval, then it bumps you directly to advertising about the Bahamas.
Absolutely. So that is why this was placed in the Ministry of Tourism. Even though it's a health visa, it was placed in the Ministry of Tourism for a number of reasons. 1 was because of the data. 2 was because the customer experience. We wanted to make sure that the persons using the visa had a wonderful experience. We had to set up a call center. We had to email people, call people, make sure, the Ministry of Tourism is the arm of government that makes sure that the foreign visitors have a pleasant experience as they come into the country. So it has served us extremely well. And you can't compare us to those other countries in the Caribbean because they have a whole different entry protocol that generally involves testing on arrival and quarantine upon arrival.
I know that from moving around, our yachting business has taken off considerably. Our boaters are coming in, they're coming in large numbers. How are we handling those health visa requirements, or what are the requirements for those coming in by boat?
So one of the reasons why our yachting business boomed was because of this health visa. Think if you would, as you go down to the Southern Caribbean, where they all like to go to Aruba and Anguilla and some of the French islands. Each one of those countries had their own entry protocols. Mm-hmm. And so for them, it was frustrating. Some of them required quarantining. They couldn't come off the boat. So when you move from one little island to another, a British territory to a Dutch territory, whole set of new rules. But what they loved about the Bahamas was they had one set of entry protocols. And when you came through that gate, you then had 700 islands to enjoy. And that is what led to a remarkable growth in our yachting business. And yachting business is extremely high end. And they were moving around, touching so many different communities in our islands. And private aviation is another one that did extremely well. They loved the fact that they could go online. It was all web-based. It was fairly easy and seamless to use. You could pay online, get a response very quickly within 24 hours. Now we're down to within 24 hours. You get a response within 24 hours, and you're on your way to the Bahamas. So it is working extremely well. And you said an important thing. You know how many people came up to me and said, we really appreciate your entry protocols. We feel safe to come to the Bahamas. This is a safe destination to come to. It's received accolades in a lot of the international publications about coming to the Bahamas and how easy it is and how safe you feel. So from that standpoint, I think the opposition would be absolutely mad to get rid of this health visa.
Well, that brings me to my next question. They have said, should they win in the next election, they will abolish the health visa. Why, in your opinion, would that be a bad thing to do?
Well, let's divide it into two categories. So you may decide for your local citizens and residents that you may want to make it free, right? So you may decide as COVID begins to diminish, we're not there yet, obviously, but as it begins to diminish, you want to get rid of it. But I can tell you, it's an excellent mechanism by which you can validate or verify person's health status before they come to the Bahamas. You do not want people showing up on your border with the wrong test because it leads to an unpleasant outcome. So this allows you to vet it before they come. And the second thing, on your visitors, from a visitor standpoint, if you want to continue with health insurance, you may or may not decide, but this is a mechanism to do it. As I said before, it gives you wonderful data. It allows you to know who's coming in, where they're going. It allows you to direct them to your Ministry of Tourism website. It allows you to do lots of marketing. And obviously the price, which the opposition said, the cost of the visa is an impediment. It might be an impediment, but the numbers reveal otherwise. The numbers are clipping up. And so people are obviously balancing the cost of that visa with, you know what? I appreciate these health protocols that they're doing. I feel safe to come to the Bahamas. I'm glad to pay it. I wouldn't like to pay it, but I understand why I have to pay it. And I'm going to come to the Bahamas, and we're seeing that in the very robust numbers that we're experiencing right now.
As we prepare to go into the break, I do want to talk about something else that is preparing to yield some significant profits for government, and has to do with the overflight fees. It is something that consecutive governments have been looking at, but you all have been able to address and implement. Tell us a little bit about how that's working and where that money is going.
Okay, so this is a huge feather in the cap for the Ministry of Aviation and this minister-led administration. Governments from independence or the early 90s have been trying to yield revenue from persons using our sovereign airspace. So as aircraft fly through our sovereign airspace, we could not, for the life of us, figure out how to charge and yield some revenue from that. This is what I call a natural resource. You hear all of the pundits going about natural resources. Well, our sovereign airspace is a natural resource, but you don't have to mine it. You don't have to use any resources. All you have to do is figure out how to bill and collect. So we managed to negotiate. Obviously, the air traffic control services in our airspace are provided by the Americans. 75% of our airspace is managed by the Americans, and 25% is managed by the Cubans. So we decided to interject ourselves into that process. We said, no. This is our sovereign airspace. If you're flying through our sovereign airspace, you need to deal with us. And
handover.
You need to deal with us. We will tell you how much to pay, and we will subcontract out the management, the provision of air navigation services to the Americans and the Cubans. But we're in the process. You got to come through us to get to them. And so we managed to negotiate a deal with the Americans where they will continue to provide air navigation services, air traffic control services in our sovereign airspace, and they will not charge us $1, not $1. So we will collect that revenue, and they will continue to provide the service for the next 10 years, absolutely free of charge. And in the first month, we started this on the 1st of May. I signed the contract. I met yesterday with my with my consultants and the ones who are leading this charge and rolling this out. And we expect to collect $2.7 million in 1 month.
$2.7 million in 1 month?
$2.7 million in overflight fees in 1 month. So that money must go into a special purpose vehicle because that money cannot go into the consolidated fund.
So the government cannot control those funds?
Well, no, the government will control the SPV. It can only be used for the provision of air traffic control services, and it only can be used to provide oversight to the aviation industry. So the two arms of government that it can be used to mitigate the costs are the air traffic controllers and the Civil Aviation Authority, which provides oversight to the aviation sector in the Bahamas. So those are the two areas, and anything that any infrastructure that you want to spend money on to enhance your air navigation services in the country, whether you build new towers or put new equipment in or whatever it is, you can put it on that. But you can't use it for hospitals and roads and schools and social assistance and all that sort of stuff. It can only be used for that. But what the government has very smartly done is says, okay, well, if you're getting that money from the people flying through our airspace, then we don't need to fund it. So we can take the money that we used to allocate for the air traffic controllers and the Civil Aviation Authority and use that in the consolidated fund. So there's a windfall to the Bahamian people.
So how does that impact them? I mean, is that enough to keep, to continue to meet those salaries and to provide the,
absolutely.
the upgrades that we
let's assume that we used to spend about $20 million on air traffic control services and civil aviation, and we're getting $2.7 million a month. You do the math. 10 months is $27 million, so we're going to get $30+ million from these overflight fees over a year. And we were spending $20 million from the consolidated fund, so that leaves $10 million, roughly, for us to enhance our air navigation system in the Bahamas. And you know what? One day, we want to provide the air navigation services in our sovereign airspace. So now we have a funding mechanism for us to buy the equipment, train the people, bring on the necessary human resources, so that one day when the Americans, at the end of this 10-year agreement, the Americans say, okay, you're ready now, we can take it over and be ready to manage our own sovereign airspace. And so that's why this has been such a remarkable deal.
The air traffic controllers are calling your office right now to ask about the Don't go anywhere. We will have more on the record, our final segment, right after this. Stay with us. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Watching On the Record, I'm your host Jerome Sawyer, and this is our final segment. Tonight we're discussing the travel visa. As we've spent a significant amount of time, Minister, on that, I want to use this opportunity, though, in this segment to talk a little bit more about tourism itself. Despite the comments from your critics, tourism is rebounding. The numbers are there to show it. We see cruise passengers departing and returning from our port for the very first time. Crystal Cruises is making an inaugural voyage to several Bahamian islands starting this weekend. The hotels are reporting anticipated occupancy of up to 90%. What does all of this say about the return of this vital industry?
So, Jerome, tourism is bouncing back very robustly. I looked at the numbers for June. As you know, June just ended yesterday, and we are about 81% of where we were in 2019 for the month of June. So we have clawed back 80% of our stopover visitors. I'm not talking about cruise passengers, this is stopover visitors. So as the months have rolled on from the beginning of the year, you know, we started off the year with 21,000, then in February we went to 28,000, then to March we went to 60,000, then to April we went to 64,000, then to May we went to 110,000, and now to June we're at 135,000. So as you can see, the trend is upward. People are coming back, certainly in the stopover component. And you mentioned a very important fact, the home porting. What a great program that has been. Royal Caribbean and Crystal Cruises, which starts tomorrow. People have flown in for their cruise. This is the best of both worlds. They've flown in for their cruise. They spend a couple days in Nassau. They go to restaurants. They get in taxis. They go into casinos. They do excursions. They then get on their cruises and they go to other islands in the Bahamas, particularly Crystal Cruises, which is going to have their entire journey within the Bahamas, going to Bimini, going to Grand Bahama, going to Long Island, going to San Salvador, going to Exuma. So that's a wonderful cruise where they're strictly staying in the Bahamas. First time we've ever done it. Historic. And so that is having a significant impact. If you speak to Mr. Wesley Ferguson, the taxi cab union, he said, man, things good. I read in the paper yesterday. He says, taxi cab drivers, as an indicator, as a provider of a service in the tourism sector, are doing very well. So this is exactly what we're seeing. And as you mentioned, the hotels are doing very, very well. Atlantis, I spoke to Audrey Oswald, the CEO of Atlantis last week, and she said, we're booked out. We're running 92% occupancy. Just come from Bahama. Last weekend, they were 75%. This weekend, they expect to be up to 80%. They're opening their water park, spend $200 million, getting 500 Bahamians, specifically Freetown constituents, back to work. I got to put that plug in. So my constituents, this is where they are feeling it. Because as the tourism sector comes, in my words, roaring back, Bahamians are going back to work. Now to the cruise component. From July the 2nd to the July the 10th, Independence Day, we expect 13,000 cruise passengers to come into the port of Nassau. So that sector now is getting going. Not only the home porting component of it, but cruises that are initiating or starting from Florida as they have done in the past.
So does this now indicate and signal the reopening of downtown?
It should do. If you're going to have 13,000 persons over the next, from July the 2nd to July the 10th coming into the port of Nassau, I would expect.
Straw market.
Straw market will obviously have to open under new protocols. I think they're trying to iron out, because it's very tightly packed in there. So they're trying to figure out, who comes on what day and how many people can go in there. I mean, if everybody was vaccinated, then everybody could go back. But you won't have that. Mm-hmm. But obviously you need to open in stages, and to make sure the persons don't sit on top of each other.
Mm-hmm. Now, I want to talk about how these other islands can maximize this cruise ship business. Because if you're going to San Salvador, Long Island, Grand Bahama, we know that traditionally the stopover visitors are the ones that spend the most. But if people are coming in via cruise ship, how are the people on those islands going to benefit from all of this?
Okay, so this is very new for us. And I must say we've had some challenges trying to figure out exactly your question. How do we deepen the impact? So we've had to, first of all, go to those islands, figure out how we're going to get the persons from the cruise ship onto the island. Then we have to figure out how we're going to transport people to particular venues. Mm-hmm. Then we have to figure out how we're going to provide them with services, whether they go to a beach or they have umbrellas, food and beverage, how that's all going to work. And so Crystal Cruises, I mean, I must give them enormous kudos. I mean, this has been a heavy lift. Obviously, the more remote you go in the Bahamas, the more of a challenge this becomes.
Long Island, you're talking about Long Island.
Yeah, so these have been very challenging undertakings by Crystal Cruises, but I'm delighted that they are prepared to soldier on. And I guess over time we'll see. I mean, they've spoken to vendors on the ground, excursion providers. They've booked excursions for their passengers. They've obviously had to sort of limit the amount that each person can do. You can only, this excursion can only deal with 30 people, and this one can only deal with 25 people. And they built in an itinerary around what is available on that island.
Sure.
So, I think it'll improve. They're here for 4 or 5 months. And so as time goes on, I'm sure that they will get better at it.
So let's talk about, though, how, beyond what is there now. If I'm looking to, if I know you're going to, let's go Long Island, and I see an opportunity to do an excursion or some business that's going to benefit, a lot of times we are impeded by the cost of doing business, a lack of concessions, all of those kinds of things. And if I'm a small businessman just starting out and I see an opportunity, what's there, have you considered how are you going to help me get started?
So the government obviously has the Small Business Development Corporation, which is a mechanism by which you help to fund small businesses in this regard. It's a little bit more difficult in this instance because we're not guaranteed a lifelong supply of passengers.
Sure.
So this is, home porting. This has been a great stopgap measure while the cruise companies kind of worked out their differences with the CDC. And this was a mechanism by which the cruise companies said, look, we just want to get back in business.
Sure.
And the CDC is just not paying us any mind right now. They're in the process of rolling out vaccines in the US. And so they came to us and we, you know what, let's go for it. Let's take an opportunity and let's see how we can deepen the impact. So on the islands,
the passengers have to be fully vaccinated, correct?
Oh yes, everybody on that cruise is 100% vaccinated, and all the crew are 100% vaccinated. And so, you know, we've gone down into each one of the islands and we said, okay, we've had meetings with the local community. What is it that you can provide? What are the opportunities here? The Ministry of Tourism hasn't so per se been involved in that process, but we brought the vendors together with the cruise company and said, okay, negotiate your commercial terms. And they seem to have been able to build itineraries. And, you know, we're going to have a dry run this week. So, you know, they're going to start their very first cruise. Let's see how it works out. But, you know, I'm just delighted that we have the opportunity. And of course, on each end of the cruise, when they come to and from Nassau, they have an opportunity to stay here and take advantage of what is available here. But they also have the ability to take advantage of what's on the island. So, for example, when they go to Bimini, there's a lovely beach club there that they're going to spend the day there. And as they go down to different islands, if you go down to Exuma, you know, you can play golf at Sandals. You can go on go to see the swimming pigs. You can go on a fishing tour. So they built all these different excursions, and people have had to, you know, provide them with, you know, what resources they've had. But it's been engaging, and people have stepped forward, which is delightful.
The fact that the cruise ships are requiring that you be fully vaccinated really speaks volumes. Are you concerned that with the level of vaccine hesitancy that we still have in this country, that we can see a slowing, or there can be a missed opportunity for us as a result of this hesitancy?
So let me just correct you on something. While on the Crystal Cruises, everybody is going to be vaccinated, not everybody coming on the other 5, MSC, Royal Caribbean, Carnival, are going to be 100% vaccinated. Okay. You know, there are going to be some persons that take the PCR tests, especially kids. And so the Crystal Cruises is all adults. So hesitancy is of deep concern to me. You know, what it does is it makes us susceptible to outbreaks. And when you have these outbreaks, the government is then minded to restrict, put in curfews, put in lockdowns in order to mitigate the spread of it. So if you're going, for example, there's been a little bit of an outbreak in Bimini. So the government, of course, now has to act to try to mitigate the spread of that, because it can't simply do anything. You know, very interesting, a house in Bimini, 4 people in there. Everybody, one person vaccinated, perfectly fine. The 3 persons who are not are ill. So, you know, it really is of deep concern to the government, this hesitancy. And while I understand everybody has their personal reasons for not getting it, all I can say is the world and the developed nations are embracing these vaccines and getting very, very high vaccination rates. The United States, for example, has been the most successful, is, you know, in the high 60s. The United Kingdom, all of our source markets. Europe is coming very quickly behind. They've been a little slow out of the gate, but they're coming quickly behind. And we're still languishing in you know, below 20%. So we really have to push that to make ourselves less susceptible to these outbreaks, because nobody really wants to travel to a country that's a high level of COVID. And because we have a small population, we get 10, 20, 30, 40, 50 people. It's a high percentage for us.
Yeah, and I don't know if we always recognize that. And that's troubling. It is troubling to me too. But anyway, that's another show. Sir, the Attorney General has indicated that we could see the ending of the emergency orders by next month, August. What are the indicators for us that this could happen? And do you see that happening on the current trend?
You know, I'm always a little worried about such pronouncements about ending the emergency orders because of our low vaccination rates. I mean, we can flare up at any moment, given the fact that there are not sufficient persons vaccinated. So I'm a little bit more cautious.
Right.
I'm of the view that we really have to improve the amount of people that are vaccinated before we can take an emboldened step. And I want people to say, I am so sick of curfews, and I am so sick of being locked down, and I'm so sick of having all these restrictions on my life, and I can't wait to return to a certain amount of normalcy. Mm-hmm. But I need everybody, all of our citizens, really to embrace this in order for that to happen, because that is the condition. You know, you're watching the basketball on TV, and you see everybody in the stadium, and everybody piling up on everybody, right? And and they're all vaccinated. That's a condition of going into the stadium, and these are the rewards that you can enjoy if you get vaccinated. And so the normalcy, returning back to a normal life, is one of the critical benefits of this vaccination. And I'm so desperate for this to be behind us. I'm so sick of it, as I'm sure everybody is, and all of these restrictions, and you can't go here and you can't go there. And the government is only doing it, in my mind, to protect an outbreak. Because if it were to do nothing and everybody could move wherever and do everything, and the vaccination rates didn't improve, we would be back to flare-ups, which are not advantageous at all for the country. And certainly, when visitors are considering the destination, they look at where we are in our CDC level 3, and they look at whether we're green, amber, or red in the United Kingdom. And we're amber in the United Kingdom, and we're CDC level 3. And Lord knows I don't want that to move.
We've got to wrap up, and you're quite right. And it doesn't help when you say to them, "Oh, our curfew's at 11."
Yeah.
So, that's part of our responsibility as well, I think, as people. We have to look at the bigger picture at the end of the day. Minister, we're out of time. Thank you very much for coming on. Welcome back to the studio.
I am so delighted to be your number one, your first customer back on.
So definitely.
Back on show.
If I knew, we'd have had a plaque for you, but next time. That's going to do it for this week's episode of On the Record. I want to thank my guests for taking time to be with us, and certainly to my technical and production staff for making it all possible, and of course to you, our audience. Special thanks for watching. We couldn't do any of this without you if you didn't tune in to watch. So before we go, the team wishes our associate producer, Marcos Ambrister, a very happy birthday. He celebrated his birthday this week, and he's off. And guess what, Marcos? We did the show without you. We carried on. Hope you're enjoying it. Well, we'll see you next time. Same place, same time, right here on The Record. Thanks for watching.